Hi guys, welcome back to Codemaster Coach, your medical coding tutor. Guys, on last week in my video, I talked about ways to increase your speed while coding. And one of the comments that I made was knowing which classification to use when, and immediately going to that classification. As a medical coding instructor, I'm so quick to say, okay, for diagnoses, we use ICD-10-CM. For professional procedures, we use CPT. And for supplies, we use HCPCS. But aren't there times when it can get a little questionable about which classification to use when? Let me challenge you. I put together some examples. So let's look at each of these examples that I put together. And you tell me, when do we use HCPCS and when do we use CPT? All right, let's look at ambulance services. Think about who's rendering care during these services. It's usually an EMT, emergency medical technician. Therefore, those services are covered with HCPCS. What about chiropractic services? Well, chiropractors are doctors of chiropractic, therefore they can use CPT. Look at chemotherapeutic drugs. Now these drugs are medications. These are a supply. Therefore, they're captured with HCPCS. And then consultations. Now with consultations, it gets a little tricky. Is it a consultation with a licensed MD? If so, it's CPT. But if it's not with a licensed MD, then it would be with HCPCS. Therefore, I'm going to say both in this case. All right, look at dentistry. We've had a lot going on lately with dentistry because in the past, dental services were always captured with HCPCS coding. Think about it. Fillings, cleanings. But we're seeing a lot of dental care go into medical care. And think about the dentist is a licensed MD specializing in dentistry. Therefore, the licensed MD services can be captured with CPT. So I'm going to say both. So again, it depends on, is it the hygienist doing the cleaning, or is it the licensed MD of dentistry performing major dental surgery? Then that would be a CPT. Durable medical equipment. Again, this is an equipment. This is a supply. Therefore, it is a HCPCS code. Look at hospital visits. Again, in order to be admitted to a hospital, you need a licensed MD to write the order. Therefore, that is captured with CPT. Injections, the actual injection drug. One, it has to be ordered by this licensed MD, but it's captured, the actual coding for that medication is a HCPCS. So I can see both coded in this situation. Let's keep going. Look at your office visits, depending on what type of office visit. If it's with a licensed MD, your family practitioner, your OBGYN, etc., that's a CPT. But if it's an office visit not with a licensed MD, then it's going to be a HCPCS. So I could look at both. Ophthalmological services, eye doctors. These are doctors of the eye, CPT. But the actual supply, the lens, the glasses, etc., are HCPCS. So here I would identify both. Orthotics and prosthetics, artificial shoulders, the limbs, the knee replacements, the shoulder replacements, those are a supply. Those are HCPCS codes. Look at pathology and lab. And the best way that we think of pathology and lab, we're thinking about body fluids that are sent to the lab. In that case, that is a HCPCS for the supply, the tubes, the lab work that's being done. But pathology, the pathologist is a licensed MD. That's a CPT. So I would capture that with both CPT or HCPCS, depending on which side you're coding. Are you coding for the lab or are you coding for the pathologist? Let's keep going. Rehab services. Here, there are doctors that order the rehab services. There are doctors that oversee the rehab services. Those are CPT. But the actual physical therapy or supplies for physical therapy, occupational therapy, etc., are HCPCS. So in that case, I'm looking at both, depending on what you're coding in these particular areas. And then we're back to, again, any other type of supplies in healthcare are HCPCS. The surgery. Surgery is done by licensed MDs, but the actual surgery is the HCPCS for the supplies in the operating room. So I would capture that with CPT and HCPCS, depending on what are you coding for the hospital for the supplies, or are you coding for the physician that's performing the surgery, the CPT. And then back to vision services. That could be both. Is it a licensed MD doing your corrective vision services, or are you there for glasses, the HCPCS? So this can be both. So again, guys, I'm asking you, how do you know which classification to use when? Look at who's rendering the services to determine which provider you would code for. All right, guys. I never ask, but I will. If you have not yet subscribed, be sure to subscribe to my channel. Show me that somebody's out there listening to me and that what I'm offering is of some value to you. So subscribe, and I will see you in the next one.